Welcome to another MU Healthcare Ask the Expert podcast. I am your host, Cosmo, from the morning show, Cosmo and Cat Show on Y107. As we get into October, Breast Cancer Awareness Month, a great time to remember that early detection can make all the difference. And to help us understand why screenings are so important, we turn to MU Healthcare breast cancer surgeon, Dr. Nicole Nelson, with us. Why is sticking to a regular mammogram schedule so important when it comes to breast cancer?
So mammograms can find cancers when they're tiny, oftentimes before you can actually even feel a lump. The average lump found by a regular screening mammogram is about the size of a pea or even smaller. The average lump found by accident or on self-exam is actually usually around the size of a strawberry. The smaller and more contained the cancer is means treatment's often simpler and outcomes are better. And early detection often leads to less aggressive therapy, a faster recovery, and most importantly, peace of mind.
So self-exams are good, but they don't replace mammograms, right?
That's correct.
When should most people start getting mammograms, and who should consider starting maybe earlier?
For people at average risk, we recommend starting annual screening mammograms at age 40. But if you have a strong family history, a genetic mutation like BRCA1 or BRCA2, or other risk factors, screening may actually start much earlier. And if you're unsure about your risk, we can do a quick risk assessment to personalize your screening plan. If you do end up falling in the high-risk category, we have a dedicated high-risk breast clinic that provides early expert monitoring and options to reduce your risk.
How many times have you heard a story, it was because of the mammogram, it was because of early detection that they found something early and were able to save a loved one or a friend's life? You know, October Breast Cancer Awareness Month, a great time to remember that early detection so key. We've got MU Healthcare breast cancer surgeon Dr. Nicole Nelson with us. You know, we probably all know someone, again, who has put off a mammogram for whatever reason. What would you say to help them take that next step?
So first, mammograms are quick, only about 15 minutes. And while there is some brief pressure, it's usually very manageable. You can get in and out and on with your day in less time than it actually takes to grocery shop. Second, they're easy to schedule. You can make same-day appointments in both Jefferson City and Columbia, so you don't need to wait months. And third, most insurance covers screening mammograms, and resources are available for those who don't have coverage. Our team can help with any cost questions that you might have. One other thing, too, about scheduling mammograms is that you don't need an order from your doctor to schedule your mammogram. You can actually schedule that yourself without an order.
That's right, muhealth.org/schedule my mammogram to learn more about MU Healthcare's breast cancer screening options, and again, to schedule yours today. To help us understand why screenings, mammograms, and so much more are so important, we've got our special guest this morning, MU Healthcare breast cancer surgeon Dr. Nicole Nelson here with us. You know, some women have dense tissue, which can be harder to detect cancer on a regular mammogram. What options do you have for them in that case?
So the best option for dense tissue is often a 3D mammography, which we offer both in Columbia and Jefferson City, and even on our mobile mammography unit. And there's no difference for insurance or scheduling. You can still get in the same day. If needed, we may add an ultrasound or a breast MRI for a closer look. And the goal is really to match the tools to your risk, so you're screened appropriately without any unnecessary testing. Dense breast tissue can also be a factor that puts you in the higher risk category, so we'll evaluate each patient's risk beyond tissue density and can refer to our high-risk breast clinic for additional monitoring and risk prevention if necessary.
We have a special guest from MU Healthcare. Breast cancer surgeon Dr. Nicole Nelson is here talking about early detection, reminding you, get those mammograms done. It can make all the difference in the world. Now, if a screening mammogram does show something abnormal, what happens next?
So the good news is that most callbacks are because we need additional imaging for things like dense tissue. And only about 1 in 10 callbacks ends up being for cancer. In the event that it is cancer, you'll be placed in expert hands with our team. At both Ellis Fischel and Goldschmidt Cancer Center, we have dedicated breast cancer teams, and all we focus on really is breast cancer. So we know the ins and outs of the disease. All of us are fellowship trained, and we specialize in care and research that makes our patients' lives easier, including nipple and breast sparing surgeries and access to the latest research and clinical trials.
Again, our expert this morning, our doctor from MU Healthcare, breast cancer surgeon Dr. Nicole Nelson, to learn more about all that MU Healthcare can offer you in breast cancer screening options and to schedule your mammograms today, muhealth.org/schedule my mammogram.